One person dies every 33 seconds in the U.S. from heart disease, but the World Health Organization says 80% of heart attacks and strokes are preventable. Not only is prevention key, but exciting new research reveals there may be a new way to help slow aging and extend lifespan. With me today is Dr. James O'Keefe, cardiologist and medical director of St. Luke's Charles and Barbara Duboc Cardio Health and Wellness Center. Thank you so much for joining us.
Yeah, my pleasure, Lindsay.
So Dr. O'Keefe, first of all, why is it so important to take steps to prevent heart disease before you even have symptoms?
So yeah, heart disease is still the leading cause of death in America and worldwide, despite really a lot of great progress over the last 40 years. But this is a disease that festers below the surface for years, often decades, before something blows up and you rupture a plaque and you have a heart attack, which could kill you, or have a catastrophic stroke. So we can see this disease developing. We have really non-invasive, simple techniques to find it. You can have risk factors, and we dwell on risk factors too, but we look for plaque early. And if you have it, we're all over it, and we can keep you healthy, to be 100 years old or longer, but we just have to know.
And what are some strategies that you'd recommend for preventing heart disease?
So the tried and true strategies are diet and lifestyle, exercise, sleep, and those are so important. Mm-hmm. And I like to say that a good healthy lifestyle is its own best reward. People say, oh, I don't want to do all this stuff, but the reality is you will feel better when you get to bed at night, and when you make a point to get outside and get some fresh air every day, and when you avoid sugar and just engage in social activities that make you happy. So those are the fundamentals, and you can't get around that. That's super important.
Okay, and what about getting a cardio scan?
Cardio scan is a CT scan just of the chest. In between heartbeats, we take a quick picture and look for the presence of calcified plaque. It's a $50 test. You don't have to get undressed. There's no IV. It takes a minute or two. We really rely on that a lot. It's a great tool for finding people who otherwise wouldn't know they have heart disease, because this stuff festers below the surface for decades. And so we find out about it, and then we can, really double down on getting the cholesterol down and making sure the blood pressure is okay, and people are following the diet and lifestyle sort of axioms.
Fantastic. Now, recently you published some exciting research on SLGT inhibitors and how they can benefit a patient. Can you tell us about this review and how these inhibitors work?
Yeah, so the sodium glucose cotransporter is a class of drugs that came out about 10 years ago. These are diabetic drugs at first. They're simple. They just block reuptake of glucose in the urine, so you urinate out sugar. Even non-diabetics. And then we noticed early on that they really reduced cardiovascular death. And then subsequently we started seeing that they prevent chronic kidney disease and probably reduce risk of cancer and neurodegenerative disease and atrial fibrillation and a lot of these diseases of aging. So we recently published the paper proposing these as drugs that slow aging. It would be the first drug ever that really has solid data for it. And aging is the number one risk factor for things like these diseases of aging, like heart failure and heart attacks and dementia, wow, and Alzheimer's disease. And so if we could slow aging rather than play whack-a-mole and wait till they come up, we slow aging, and all these diseases are reduced in their incidence, and we also improve life expectancy. So, it's too early yet to kind of make that formal recommendation, but to me, this is the most exciting thing out there right now, and I think in the future this may be a therapy that a lot of healthy middle-aged or older people use to stay healthy.
Right. Well, you touched on this a little bit already, but what in the long run could this impact have on longevity and lifespan?
Well, even now, when these drugs look like they improve life expectancy by a few years, and these are good quality years because they're slowing the progression of aging. And my patients, I've been using this drug for upwards of 10 years, more all the time. And people on this drug tend to come back, happier and healthier. I mean, it is a tailwind to keep them sort of youthful and mentally sharp and physically capable. And it's good. It's really good for the heart and the kidneys. So yeah. And the really fascinating thing is that it slows aging at a cellular level, so that it induces something called autophagy. And autophagy is cellular housekeeping. So it basically like rejuvenates the cell. It increases the mitochondria and gets rid of the old defective ones. These are the power plants. They give us energy to carry on all the functions of life. And so when you rejuvenate the cells, then that revitalizes the organs and it reduces the risk of all these diseases of aging, and it improves life expectancy, not only lifespan, but health span, healthy life.
Gosh, that's fantastic. Well, is there anything else you'd like to add as far as heart disease prevention and things people can do?
Well, I think a really important thing that is underemphasized, at least by physicians, is we've been doing some studies lately about the importance of omega-3 for keeping the brain and the heart healthy. And these studies, large prospective trials that are like 12 to 15 years in length, following 160 or 180,000 people who had baseline omega-3 levels. And then we see that the higher the omega-3 level, if you can get in the top quintile, top 20%, it reduces the risk of stroke and Alzheimer's and heart disease and heart failure, and probably even suicide.
Wow.
So this is like a real simple thing you could do. Make sure you're eating fish at least 2-3 times a week, and or I think most people would benefit from taking a high-quality omega-3 supplement, a capsule or 2 a day.
Okay, fantastic. Great tip. Well, thank you so much for joining us.
Yeah, my pleasure.
To learn more about St. Luke's Cardio Health and Wellness Center, visit stlukeskc.org/cardiowellness. You can also find updates on other health news at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.